Everyone thought she was just the new nurse until she stopped the surgeon with one sentence that could have gotten her thrown out of the operating room. But if she had stayed quiet, a U.S. Marine would have died on that table. Maybe you know that feeling too well, being ignored in a room full of people louder, older, more certain than you. The fluorescent lights hum, the monitors scream. Blood floods the field and everyone trusts the person holding the scalpel. No one looks at the quiet one near the wall. What makes this story different is not just the life or death surgery. It is the hidden cost of being underestimated, the split-second judgment that changes everything, and the truth about who really sees danger first. Stay with me to the end and comment your city and state below if you're watching. And the night this happened did not begin with sirens or shouting. It began the way long hospital nights usually do, with stale coffee cooling in paper cups, fluorescent light flattening every face it touched, and people moving through exhaustion with the practiced speed of those who no longer needed to think about where to place their hands. Mercy Harbor Medical Center sat a few miles inland from the San Diego waterfront, close enough that on clear nights the air carried a trace of salt through the ambulance bay doors each time they opened. Past midnight, the city outside looked almost peaceful. Freeway lights stretched into the dark. The marina glowed in the distance. Somewhere beyond the hospital glass, people were still laughing in bars, still heading home from late dinners, still believing that the hardest part of the night belonged to somebody else. Inside the surgical wing, the hardest part of the night was simply called shift change. Nurses traded clipped updates at the station. Orders printed in bursts. Wheels squeaked over polished tile. A transport aide hurried past with a patient wrapped in warmed blankets. An old man in recovery kept trying to pull his oxygen cannula free because he was sure he had already gone home. Somebody at the end of the hall laughed too loudly at something that was not really funny, the kind of laugh meant to push back fatigue for 5 more minutes. In the middle of all of it stood Avery Cole, holding an instrument checklist in both hands, as if the paper could steady the room around her. She was on her 4th night of surgical rotation. That fact seemed to arrive in every room before she did. New nurses were easy to spot at Mercy Harbor. They still stood too straight. They read labels twice. They apologized when they needed to step around somebody, even when the other person was the one blocking the path. They had not yet learned how to compress themselves into the invisible corners of a room while still staying useful. Avery had learned part of that already. Her scrubs were a clean hospital blue that still looked new under the lights. Her badge hung flat against her chest, not bent or scuffed by months of being clipped and unclipped. Her hair was pulled back in a neat knot, with no loose strands escaping, as if she had arranged herself that way on purpose before driving in. There was nothing dramatic about her. No tattoo climbing above her collar, no loud personality, no nervous chatter. If you saw her once in the hallway, your brain filed her exactly where most people filed her. New, careful, temporary. She stood at a stainless steel prep table outside Trauma OR 3, aligning forceps by size, angling clamp handles in the same direction, making sure each packet of sutures sat within easy reach. Her hands moved with quiet precision, fast enough to be efficient, but without the restless fidgeting that often gave away inexperience. Too neat. Avery looked up. Linda Graves, Sr., OR nurse, had come up beside her without a sound. Linda was in her early 50s with silver threaded through dark hair and the steady posture of someone who had spent years commanding rooms where panic only made things worse. She had a face that might have looked kind in another setting, but under hospital lights it settled naturally into something brisk and exact. Linda lifted one of the clamp trays, shifted it 6 inches to the left, and rotated 2 instruments with a quick tap of her fingertips. In a live trauma room, nobody reaches that far, Linda said. You set it up for symmetry. You set it up for control. Those are not the same thing. Avery nodded once, understood. Linda adjusted another tray. You'll observe tonight. Yes, ma'am. Observe means observe. It does not mean anticipate correct volunteer hover or try to show initiative when there are people in this building who have been doing this longer than you've been an adult. Avery lowered her eyes to the table. I understand. Linda glanced at her for another second, waiting for embarrassment or attitude and getting neither. Good. She moved away. Avery finished the tray without changing her expression. If Linda had stung her pride, nothing in her face showed it. She simply recalibrated the layout to match the correction, then checked the blade count again. Across the room, 2 scrub techs watched the exchange. Graves is gentle tonight, one muttered. The other smirked. Give it time. Avery heard them. She did not react. That was the first thing people noticed about her, if they noticed anything at all. She did not rush to fill silence. She did not ask to be liked. She had none of the harmless, nervous brightness that made most new staff easy to guide or easy to tease. She listened. She stored things. And when someone corrected her, she absorbed the correction with a calm that left no place for anyone else's superiority to land. For some people, that calm read as maturity. For others, it read as distance. The double doors at the end of the corridor swung open, and a man in dark navy scrubs stepped into the surgical wing carrying a tablet under one arm and a paper cup of coffee in the other. He was tall, broad-shouldered, and moved with the contained momentum of a person so used to being followed that he no longer looked back to check whether anyone was keeping up. Dr. Reed Mercer. The mood around the nurses' station changed in subtle ways that said more than any introduction could have. A resident straightened from the counter. A circulating nurse tucked a stray curl behind one ear and moved a cart out of his path before he had to ask. A trauma fellow lowered his voice mid-sentence and stepped closer with the chart ready. Mercer was not the kind of surgeon who needed to announce himself. He did not perform authority. He simply occupied it so completely that rooms arranged themselves around him without being told. He stopped at the board, skimmed the surgery schedule, then took a sip of coffee that had probably gone cold an hour ago. He had the tired, sharpened face of a man who had learned to function on fragments of sleep and bad cafeteria food. Fine lines marked the corners of his eyes. His hands, even at rest, looked purposeful. Gallbladder got bumped again. He asked nobody in particular. Postponed for trauma overflow, a resident answered. Mercer grunted, unsurprised, and shifted to the overnight emergency board. His eyes moved once across the names, then caught on Avery standing by the prep table. He tilted his head slightly. New rotation. Avery looked up. Yes, sir. He glanced at her badge. Cole. Yes, sir. How long have you been in surgery? 4 nights. A tiny smile touched one corner of his mouth, so brief it almost missed becoming expression. Then tonight your best move is to stay out of the sterile field and keep your eyes open. That was already my plan, Avery said. It was not defiant. It was not trying to be clever. It was simply true. Mercer held her gaze half a second longer than he meant to, then looked away. Good. He moved on, already discussing a consult with the trauma fellow. The exchange should have ended there, one more forgettable sentence in a hospital full of them. But Linda, who had heard it, looked back at Avery with mild surprise. Most rookies either stumbled around Mercer or tried too hard to impress him. Avery had done neither. Still, by the time Mercer disappeared into the scrub room, Avery was just the new nurse again. The monitors in pre-op hummed. A printer spat out labels near the nursing station. Someone, somewhere, cursed softly because a medication cabinet refused to unlock on the first try. The entire floor settled into that strange hospital rhythm where nothing feels calm even when nothing has happened yet. Avery checked the clock above the medication room. 12:37. She had learned that hospitals changed after midnight in ways outsiders never understood. Daylight belonged to policy and routine, and administrators in pressed shirts. Night belonged to instinct. Fewer people, fewer buffers. Less conversation for the sake of appearances. Whatever a person was under pressure, the night shift found it faster than daylight ever could. She carried a stack of sterile packs into Trauma OR3 and paused just inside the doorway. Even empty, the room had a kind of charge. Overhead, surgical lamps hung above the operating table like white suns waiting to be lit. Stainless steel surfaces reflected dim strips of fluorescent light. The anesthesia machine sat quiet for now. Hoses looped neatly monitored dark except for one standby pulse. Instrument tables stood covered, draped expectant. The smell in the room was part disinfectant, part chilled air, part memory. Every operating room had memory, sweat under masks, gloved hands slick with urgency. Decisions that bought people years, decisions that stole them. Avery set down the sterile packs and looked at the monitors without seeming to look. Heart rate module, arterial pressure inputs, oxygen saturation, waveform settings, lead placements on standby, everything where it should be. And yet, she had a habit that never belonged to ordinary hospital training. She checked the room the way some people checked exits in a crowded theater. How quickly could suction be changed if the line clogged? Whether the backup blood warmer had already been plugged in. Which corner of the room gave the clearest view of both the table and the monitor bank. Where a person could stand and remain invisible while still seeing enough to matter. She heard footsteps and stepped back from the anesthesia tower a moment before Dr. Ben Holloway entered, rolling his shoulders under his scrubs as if trying to work the stiffness out of a long day. Holloway was younger than Mercer by a decade, maybe more, with tired eyes and a face that still carried some softness, despite the strain of trauma nights. He set his notes beside the machine and glanced up when he noticed Avery near the monitors. "Hey," he said, "you're the new surgical rotation." Avery Cole. Ben Holloway. I'm the one who gets blamed when blood pressure does something rude. That earned him the smallest hint of a smile from her. Good to know. He started checking lines and tubing. You ever done nights before? Yes. Nights in this place are different. She watched him test a circuit. Every place thinks that. Holloway gave a short laugh. That is a very suspicious answer for someone on night 4. Avery did not take the bait. I'll stay out of your way. Please do. He grinned to soften it, then started spiking fluids. A call light flashed in a room down the hall. An overhead page asked respiratory to ICU. Somewhere in the elevator bay, a child began crying with the high, inconsolable sound of fear past midnight. Avery stepped out into the corridor again and passed a family huddled outside another OR, their faces gray, under vending machine light. A teenage girl sat with her knees pulled to her chest, staring at a pair of sneakers on the floor as if she could think her way into better news. Her mother held a paper cup she was no longer drinking from. Her father stood rather than sat, because sitting looked too much like accepting that there was nothing left to do. Avery slowed almost imperceptibly as she passed them. The girl looked up. For 1 second their eyes met. Avery gave the smallest nod. Not reassurance, not a lie, just a human acknowledgement that someone saw them. Then she kept walking. By 1:10 in the morning, the floor had settled into the kind of deceptive quiet that comes just before something breaks. The trauma board was not empty, but manageable. A motorcycle fracture in ortho, a ruptured ectopic being wheeled to OB surgery. One elderly man waiting for a bowel obstruction consult. Enough to keep everyone moving, not enough to tip the floor into crisis. Mercer had finished one consult and was dictating notes at the station, speaking into the recorder with the clipped precision of someone who disliked paperwork, but disliked inaccuracy more. Avery was restocking a cart when the overhead speaker crackled. Level 1, trauma inbound. Adult male. Multiple gunshot wounds. Thoracic involvement. ETA 2 minutes. The entire floor changed shape. Mercer was already moving before the announcement finished. Linda snapped for extra blood tubing. Holloway swung into Trauma OR3 and began waking every machine in the room with a series of quick, practiced motions. A resident cursed under his breath and jogged for imaging support. Someone pulled open the warmer drawer. Someone else called the blood bank. Gloves snapped over hands. Doors opened. Wheels rolled. Conversations narrowed from full sentences to command words. Avery stepped aside to let a crash cart pass, then moved with the flow toward the trauma bay without ever appearing to insert herself into it. She had been told to observe. This was still observation. It just happened at a faster speed. The gurney hit the bay hard enough to rattle the side rails. Paramedics surrounded it, all of them slick with effort and road dust and the bright tang of recent adrenaline. On the stretcher lay a man in a shredded tan shirt darkened almost black with blood. His chest rose in shallow bursts under oxygen. One shoulder was packed, his abdomen was wrapped. The dressing on the upper left side of his torso had bled through twice. Male estimated 28. One paramedic called as they transferred him. 3 confirmed GSWs, 1 through the left deltoid, 1 lower right abdomen, 1 entry anterior chest just off sternum with possible track toward pericardial space. He was conscious on scene, altered in transport. Pressure was 82/50, then 90, then dropped again. We pushed fluids, no sustained response. Another paramedic was already cutting away what remained of the shirt. Breath sounds present but tight. No tension signs on our needle eval. We had intermittent pulse pressure narrowing en route and some weird rhythm variability. Couldn't pin it. He's federal hold. Agents requested status as soon as stabilized. Mercer leaned in over the patient before the sentence was done. Name: Staff Sergeant Mason Tate, U.S. Marine. Mason's eyes fluttered open for half a second, unfocused and furious in the way wounded soldiers often were, too driven by survival to surrender fully to pain. His hand jerked weakly against the straps. A medic caught it. "Stay down, Sergeant." Mason tried to speak and coughed instead. A bright fleck of blood touched his lip. Holloway slipped to the head of the bed mask already in hand. "Easy," Holloway said. "You're in the hospital. Don't fight me." Avery stood just outside the tight circle of motion, and while everyone else tracked the wounds, she watched his breathing. It was wrong. Not absent. Not the heaving air-hungry struggle of a chest blown open by catastrophic loss. It was smaller than that, more controlled in a way that almost looked voluntary, as if the body were trying to limit movement because every expansion cost too much. His face was pale beneath the blood, but not empty pale, pressed pale. His neck muscles were tight. A vein at the base of his throat caught light for a second and seemed fuller than it should have been. Mercer ran a quick hand over the chest dressing, scanning entry points, calculating trajectory. "Move. I want ultrasound, now." The trauma bay filled with overlapping voices. Pressure 76. Crossmatch pending. 2 large bore lines in place. Abdomen rigid on the right. Portable chest on the way. Mason winced as hands pressed and turned him. A tattoo on his forearm flashed between gloves and tape, an eagle and anchor faded by years of sun. On another night in another room, Avery might not have looked twice. Tonight she did. Not because of the tattoo itself, because his breathing changed when Mercer pressed near the sternum. Smaller, guarded. Holloway began pre-oxygenation. "Mason, listen to me. I'm going to help you breathe." Mason's gaze drifted, caught on nothing, then on Avery, standing back from the bed. For the briefest second, he seemed to focus on her face, not with recognition, just with the reflex people have when they are searching a room for the one still point in it. Then the mask covered his face. Fast imaging was ordered and delivered in the efficient chaos only trauma rooms understood. A portable scan caught enough to suggest survivable abdominal injury. Shoulder wound looked ugly but manageable. The chest wound sat too close to the heart for anyone's comfort, yet no obvious massive hemothorax announced itself. Nothing on the quick view looked like an immediate explosion. No one relaxed, but the team began forming a coherent plan around what they saw. Control the abdominal bleed. Explore the thoracic injury. Move fast. Mercer made the call. "We go straight to OR. I'm not wasting time waiting for prettier images." Nobody argued. The gurney rolled. Doors slammed open in sequence ahead of it. Avery walked alongside the team just long enough to catch one more look at Mason's chest. The rise was shallower now. The space between inhale and exhale seemed to linger a fraction too long, as if the body was negotiating with itself each time. She glanced to the monitor, clipped at transport level. Heart rate elevated, pressure unstable, something else there in the line. Subtle, uneven. A transport nurse brushed her shoulder. Cole, clear the path. Avery stepped back at once. Sorry. Trauma. Or 3 exploded into light. Surgical lamps came down white and hot. Drapes unfolded. Instrument packs were snapped open onto tables. Holloway took the airway and secured it with the brisk focus of a man who had no interest in dramatics and even less in mistakes. Linda organized the room with clipped orders that landed like taps of a conductor's baton. Clamp tray on my right. Blood warmer ready. Need another suction line. Where is my resident? The resident appeared breathless. Here. Mercer scrubbed with his head bent water, running red-brown into the basin after his first contact with the patient. The resident rattled off wound details. Holloway called pressures as if trying to hold them in place by naming them. Avery stood where Linda had told her to stand back, near the wall beyond the field, close enough to see but far enough that no one had to factor her into the room. It was the kind of place most people forgot within minutes. For Avery, it was exactly where she wanted to be. From the wall, she could see everything at once. Mercer's shoulders, Holloway's monitor bank, the arc of the sterile field, the assistant's hands, the line on the patient's throat above the drape, the lag between one beat and the next. Surgery began. The abdominal wound was addressed first because it was visible, direct, and fit the logic of the scene. Blood where blood should be. Damage where damage could be touched. Mercer worked with quick, economical precision, giving half-spoken orders that his team understood without repetition. Suction. Lap sponge. Hold there. His calm was not theatrical. It was functional. In rooms like this, calm was contagious. For several minutes, the procedure seemed to obey the expected script. Blood loss, yes, but not explosive. A shoulder injury that looked dramatic but did not threaten first priority. A chest wound that remained concerning without yet revealing itself as the center of the storm. At the back wall, Avery watched the monitor. Her eyes moved from the arterial pressure waveform to the ECG trace, then to Mason's chest rise beneath the drape, then back again. She was not looking for a miracle. She was looking for pattern. A narrowing between systolic and diastolic. A tiny sway in electrical amplitude from one beat to the next. Not enough for anyone busy with a scalpel to trust over what they could see. Enough for someone standing back to feel the first cold edge of wrongness. Holloway adjusted medication, pressure soft. Mercer did not look up, expected. The blood suctioned from the field. Not light, not negligible. But not enough, Avery thought. Not enough to match the way the waveform was changing. A nurse beside her leaned toward another and murmured, "He's weirdly tight for this much volume on board." The other nurse shrugged. Chest trauma. Avery said nothing. Minutes passed. The room narrowed into the tunnel every OR knows where the whole world becomes hands and time, and the mechanical counting of blood loss against survival. Mercer reached deeper into the chest. The rhythm on the screen shifted. Not louder. Wrong. Avery tilted her head slightly. A move so small no one noticed. Electrical alternation. Barely there. One complex taller, the next smaller, then taller again. Easy to dismiss as artifact if you had already decided the story the body was telling. She let her gaze drift to Mason's neck. From this angle, half obscured by drape and positioning, she could still see the subtle fullness there, the venous pressure that should not have been ignored. Her fingers tightened once at her sides, then relaxed. Linda crossed the room and brushed past her with a tray. "Cole, if you're going to stand there, at least stay awake." Avery looked at her. "Yes, ma'am." Linda moved on. The arterial line dipped. Holloway frowned at the numbers. "Mercer, talk to me." Pressure trending down. From what? 80 to 66. Narrowing pulse pressure. Mercer asked for another clamp without taking his eyes off the field. We knew he'd bleed. Avery watched the waveform. It was not just a loss. It was a struggle, a body failing to fill, a heart trying to beat inside less and less room. Her mind did what minds do under pressure when they have been trained by the wrong kinds of places. It stripped away the room, the polished stainless steel, the overhead lights, the clean drapes, and replaced them with harsher things. Dust, rotor wash, a chest under open sky, the sound of somebody gasping around blood while someone else shouted for a bird that was still 3 minutes out. She blinked once, and the operating room returned. Holloway adjusted again, still dropping. Mercer's tone sharpened. "How much blood are we into?" "Approaching 4 units total. That should be buying me more than this." Exactly, Avery thought. A small swelling along the neckline caught the light again. One beat stumbled, then another. The sound from the monitor changed in a way that made everyone in the room just a little faster. Pressure dropping. Holloway called louder this time. 58 systolic. Mercer's hand went deeper into the chest. More suction. "I need visibility." Suction roared. Dark blood welled, then vanished, then welled again. A resident shifted position. "Could be a branch." "It looks like a branch," Mercer said. "Clamp." At the back wall, Avery felt the instant the room became dangerous in a new way. Not because the patient was crashing. He had been crashing. Because now everyone thought they understood why. Certainty under pressure was one of the most useful tools in medicine. It was also one of the fastest ways to miss the one thing that did not fit. Mercer extended his hand for the clamp. Linda placed it into his palm. Avery stared at the monitor. One taller complex, one smaller. Pressure narrow and narrowing. Neck vein full. Chest rise restricted. Not arterial loss. Not first. Her pulse remained steady. That, more than anything, was what had always unsettled people about her. She did not look brave in moments like this. She did not look dramatic. She looked composed in a way that made fear seem almost impolite. But inside that stillness, calculation was moving fast. If she spoke, she would break the one rule everyone had already placed around her. If she stayed quiet, the room would keep moving toward the wrong fix, because the wrong fix made more sense to everybody except the monitor. Mercer shifted the clamp into position. The monitor let out a sharp descending tone. Avery stepped off the wall. It was only 1 pace, maybe 2, but in a room built on hierarchy it felt like crossing a border. The monitor cried out again. Holloway's eyes flicked to the pressure trace, then to Mercer's hand hovering over the field. Dr. Avery said. At first, no one answered. The room was too deep inside its own momentum. Suction hissed. Steel clicked against steel. Someone at the far table called for another sponge count and was ignored. Mercer held out his hand without looking away from the chest cavity. Clamp. Linda placed the instrument into his palm. Avery's voice came again, calm enough to sound almost quiet. "That is not arterial loss." This time the sentence landed. Linda turned first more annoyed than surprised. Cole stepped back. Mercer did not lift his head. Not now. Avery did not raise her voice. She did not try to overpower the room. She simply spoke into the thin space between panic and decision. And because she sounded certain people heard her whether they wanted to or not. "It is acute pericardial tamponade." The words seemed to change the temperature. For a second, nobody moved. Then all movement rushed back at once, only now it carried a charge of disbelief. Linda stared at her. "You do not make that call from the back of the room." Avery kept her eyes on the monitor. "I'm not making it from the back of the room. I'm making it from the waveform." Mercer's jaw tightened. He was still angled over Mason's chest shoulders, locked one hand inside the field, the other gripping the clamp he had been about to place. "Step away from my table," he said. Avery did not. The Marine's pressure dropped again. 52, then 50. The alarm sharpened until it sounded less like a warning than an accusation. Holloway looked from Avery to the monitor strip and froze. "Read." Mercer did not answer him. Holloway leaned closer to the screen, frowning now, no longer seeing it as background data but as a separate story running beneath the one in the wound. "There is alternation there." Mercer finally glanced up, not at Avery, at Holloway. "Artifact." "No," Avery said. Now Mercer looked at her. for the first time that night truly looked, not at the badge clipped to her chest, not at the clean scrubs that marked her as new, at her face, her posture, the absence of fear where fear should have been. "Explain," he said. The room stilled around that single word. Avery stepped only close enough to see the monitor bank without losing the chest line in her peripheral vision. She kept her hands at her sides, careful not to invade the sterile space, careful not to give Linda any excuse to throw her out. "His pulse pressure is narrowing too fast for the blood loss you are seeing. The voltage amplitude is shifting beat to beat. Look at the neck. He is not emptying out, he is compressing." Mercer said nothing. Avery pointed with her chin toward the monitor. "Pressure is building around the heart. He cannot fill. If you clamp where you are about to clamp, intrathoracic pressure spikes, right ventricle collapses, and you turn a survivable wound into a rest." Linda let out a breath that sounded like a scoff. "You are guessing." Avery met Mercer's eyes, not Linda's. "No, ma'am," she said softly, "I am not." Mercer held the clamp in midair. A surgeon's whole life was built on moments like this, the instant when uncertainty had to become action, when hesitation could kill as surely as recklessness. Yet, this moment was unlike any he had expected to face on an overnight trauma shift. Not because the case was impossible, because the challenge had come from the one person in the room least entitled to offer it. "Scans did not show tamponade," he said. "Not complete tamponade," Avery replied. "Not then." Holloway checked the line again, his brow furrowing deeper. "The neck distension fits." Mercer snapped. "I know what fits." What he meant was that he knew what should fit. He knew the images they had seen. He knew the map that years of thoracic trauma had laid over his instincts. Chest wound near the pericardial space. Blood in the field, deteriorating pressure. Control the bleed. Secure the branch. Move. He also knew the feeling crawling up his spine, now the one he hated most in the operating room. The feeling that the body in front of him was obeying rules different from the ones the room had agreed on. Mason's rhythm stumbled a low, ugly wobble on the screen. Holloway's voice cut through the tension. "He's running out of time." Mercer looked back down into the field, then up to the monitor, then to Avery again. "If you are wrong," he said, his tone flat, "now he dies faster." Avery took one breath. "If I am right, he lives." No one spoke. Mercer's thumb tightened once against the clamp handle, then eased. "Ben." Holloway was already waiting. "I'm here. Talk to me." Holloway swallowed. "Pressure trend matches compression. Blood loss does not explain the filling pattern. It could be tamponade." Linda looked between them in disbelief. "We are changing course based on a nurse on night 4. Mercer's answer came without looking at her. "We are changing course because the monitor is not lying." He set the clamp aside. The room seemed to shift on its axis. "Prepare for controlled pericardial decompression," Mercer said. That sentence changed everything. Linda moved first because even shock could not overcome habit. New tray. Pericardial set. Suction reposition. The resident snapped into motion. Holloway adjusted medication and leaned closer to the monitor, no longer trying to rescue the old plan. Avery stepped back immediately, exactly as if she had never spoken at all. No victory, no explanation. Her place was still the wall. Only now the wall felt different because the room kept glancing toward her, even when nobody meant to. Mercer bent over the field again with a new kind of focus, the focus of a man who has accepted that the body may know more than the image it gave him 10 minutes ago. He worked carefully, releasing pressure in increments rather than forcing the chest to confess all at once. The resident retracted. Linda passed what he asked for before the request fully left his mouth. "Easy," Holloway murmured, not to anyone in particular. "Easy." A bead of sweat slipped down Mercer's temple and vanished into his cap. He adjusted, angle lifted opened, just enough. For 1 second nothing happened. The monitor kept crying its harsh metallic tone. Mason's face, half hidden by drape and airway tubing, looked drained and remote. Holloway stared at the pressure trace as if willing it to rise. Then the waveform shifted. Small at first, a change almost too modest to trust. Holloway leaned closer. The next beat filled a fraction more, then another. Pressure crept upward, as if the body itself were testing whether it was safe to believe the room had finally understood it. 58, Holloway said. No one answered. 62. Mercer did not look up. Keep talking. 68. The tone from the monitor softened not into silence but into rhythm. Thin, fragile rhythm. A nurse at the back of the room exhaled so sharply it was almost a laugh. Linda went still for half a heartbeat, instrument in hand, as if she had forgotten what her own fingers were doing. Mercer continued the decompression, measured now, eyes narrowed, every movement exact. He did not allow himself relief. Surgeons learned early that relief came later, if it came at all. But something in his face changed. Not humility. Not yet. Recognition, perhaps. Recognition that the room had just swerved away from a mistake he had been one motion from making. Pressure recovering. Holloway said, and this time disbelief sat openly in his voice. 74. Better filling. The resident turned to look at Avery before catching himself and facing forward again. From the wall, Avery watched the monitor rather than the people watching her. Mason's rhythm was steadier now. Not safe, not whole, but no longer collapsing into itself. Mercer held the retractor position and said without looking back, Cole. Avery straightened slightly. Sir, do not move. It sounded like an order, but the room understood it for what it was. He did not want her out. He wanted her where she could still see what he could not. The surgery went on. The pressure stabilized enough to buy minutes instead of seconds. Blood loss remained real, but no longer acted like the main event. Holloway adjusted the drips downward with a caution that bordered on superstition. The resident wiped his forehead with the back of his sleeve and immediately regretted leaving a damp mark on his gown. Linda resumed her rhythm, but she passed instruments now with an extra fraction of force, as though irritated by the fact that her own certainty had been interrupted. No one said the obvious thing. A rookie nurse had just redirected a trauma surgeon in the middle of an active chest case, and been right. Mercer repaired with renewed attention, listening to the room in layers. The tissue under his hands, Holloway's numbers, the resident's breathing, even the silence from the wall. He found himself aware of Avery in a way that had nothing to do with her status and everything to do with what calm felt like when it was earned. A few minutes later, Linda reached for a suture driver and came up short. Before she could ask, Avery crossed from the supply side just far enough to set the correct packet where Linda's hand was already going. It was done so cleanly that, for a second, no one reacted. The motion was smooth, economical, exact. Mercer noticed because he noticed hands. Avery had never been invited to the field. Yet, when the resident fumbled the angle of an exposed line, she lifted a hemostat from the tray edge, rotated it, and laid it down in the right orientation without ever breaking the room's flow. It was not flashy. It was the kind of correction someone made when they understood the choreography so well they did not need to think about it. Mercer's eyes stayed on her one beat longer than they should have. Linda caught the look and stiffened. Cole, back. Avery stepped away at once. Yes, ma'am. But the impression remained. Not new, not truly. Mercer bent again over the field. Mason's pressure was holding in the low 70s now. The skin at his throat no longer looked as distended. Holloway muttered a number under his breath and adjusted his hands on the airway tubing with the relief of someone who had just stepped back from a cliff edge. The resident said quietly, almost to himself, I did not see that coming. Neither did Mercer. That bothered him more than he would ever admit aloud. He had built a reputation on being the surgeon other people called when things stopped making sense. He thrived inside bad odds, inside failing rooms, inside the narrowed timeline where everyone else started to shake. He was good because he saw patterns early and acted cleanly. He was trusted because his hands did not hesitate when other hands did. And tonight, a woman with a fresh badge and the silence of a shadow had seen the pattern first. He did not resent her for it. He resented the fact that he had nearly ignored her long enough to matter. The repair continued. Minutes passed. long enough for the room to begin settling into the dangerous comfort that comes after a crisis seems solved. Long enough for one of the scrub techs to loosen her shoulders and roll tension out of her neck. Long enough for Linda to ask for a new sponge count in a voice closer to normal. Long enough for Holloway to breathe through his nose instead of his mouth. Avery did none of those things. Her eyes moved back and forth between monitor and chest field with the same intensity as before, only now there was a different quality to her attention. Not the urgency of someone trying to stop the wrong intervention. The guarded watchfulness of someone who recognized that survival had changed shape, not finished. The rhythm was better. The pressure was better. But something in the line remained unsettled. A small delay, then a tremor. Then a response that came back a fraction too hard, as if the heart were recovering into irritation. Avery narrowed her focus, replaying the last 2 minutes in the private theater of trained instinct. Decompression had worked. The filling pattern proved it. Yet the recovery was not clean. The waveform did not rise and smooth the way she wanted. It kept catching on something. Something mechanical, maybe. Something too subtle for a room still celebrating silently that the first disaster had passed. Mercer asked for sutures. Linda passed them. As he reached, Avery saw it again on the monitor. A skip. Not full instability. Not yet. A shiver in the rhythm with no business being there. He is not stable, she said. Mercer's hand paused over the field. This time nobody told her to step back. What do you see? He asked. The difference in the room was so complete it almost made sound. Avery stayed near the wall. Pressure recovery is temporary. Holloway frowned at the screen. He is climbing. For now. Linda's expression tightened. Unless you want to be specific, that is not helping. Avery did not answer Linda. There is still irritation near the cardiac wall. The rhythm is compensating. Holloway looked again this time with the kind of close attention he should have been able to trust earlier, but had not. I do not love that trace. Mercer's eyes stayed on the wound. Source. I do not know yet. That answer, more than anything, made Mercer listen harder. She was not trying to sound omniscient. She was not claiming certainty where she did not have it. She was naming the shape of the threat before she knew its face. The monitor skipped once, then righted itself. Then another beat landed unevenly. The resident looked up. Did you see that? Holloway had already seen it. Yes. Mason's heart rhythm began to tremble in subtle spikes, each one too brief to trigger panic, each one enough to poison the room with returning tension. Mercer adjusted his position. Talk. Avery took half a step closer to the monitor. The decompression relieved the pressure. It did not remove whatever is still touching the heart. Linda stared at her. Touching. Something is provoking the wall. Not fluid. Mechanical irritation. The resident said, "You mean a fragment." Avery's eyes stayed on the screen. Maybe. The word hung there. Not because it was vague. Because everyone in the room understood at once what it meant if she was right. A tiny, retained piece. Shrapnel, bone, metal, anything small enough to evade quick imaging, dangerous enough to turn every contraction into a threat. Holloway leaned over the monitor bank. Rhythm variability is increasing. Mercer said, "Can you localize it?" No. Avery's voice remained level, but the pattern is real. Mercer returned to the field with a new watchfulness. No one moved as quickly now. The surgery had become less about solving what the body already admitted, and more about listening for what it still hid. He worked in silence for several seconds, searching not for a visible crisis, but for disturbance. Tissue. Blood. Retraction. Light. The resident angled suction deeper. Linda passed a finer instrument. Holloway called the pressure every few beats as if keeping time for the room. 76, 74, 75. The numbers hovered in that maddening zone where they could be called acceptable by anyone desperate enough to move on. Avery knew better than to trust acceptable. The rhythm skipped again. More obvious now. Holloway's head came up sharply. There. Mercer followed the resident's suction tip deeper. I do not see it. Avery listened to the line with her whole body. Beat, fill, pause, beat, fill, delay, beat. The pattern was not random. It repeated with an ugly little discipline of its own. Every third contraction showed a slight lag, not enough to scream, enough to warn. She had seen that before in places where the room around the patient was never this clean. Sand in the corners of the mouth. Blood on canvas stretchers, night vision light washing faces hollow green, while rotor blades battered the air overhead. Men with chest wounds that looked survivable until something inside shifted and stole the next 5 minutes. Mercer's voice pulled her back. Cole. She looked at him. Where? Not a challenge now. A request. Avery glanced from monitor to field tracking rhythm against motion. Near the pericardial surface. Left of where you are. Small enough to move with contraction. The resident swallowed. That is a very specific guess. It is not a guess, Holloway said quietly. He had turned fully to the monitor, now studying the timing with stripped-down concentration. The delay is cyclical. Mercer adjusted left. Nothing. He shifted angle. Still nothing. The room tightened again, everyone listening for the next wrong beat. It came. A harder stumble this time, enough to set off a fresh burst of alarms. Rhythm is sliding, Holloway called. Mercer's hand jerked toward the defibrillation setup by instinct. Charge pads. Do not shock him. Avery's voice cut through the room so cleanly it felt like a blade. Mercer's head turned. For 1 second, the whole OR held on that silence. Why? His tone was not hostile. It was stripped bare. Avery answered immediately. This is not primary electrical failure. If you shock mechanical irritation against a vulnerable wall, you can tear what is only being provoked now. Holloway hesitated, hands hovering between pharmacology and electricity. That is plausible. Linda snapped plausible is not protocol. Mercer looked at her once. Neither was tamponade until 30 seconds ago. Linda went quiet. Mason's rhythm fluttered, recovered, then threatened to break again. Mercer lowered his hand from the pads. Then guide me. The words landed with more force than shouting would have, because they meant trust. Not complete, not comfortable, but real. Avery stepped closer to the monitor still outside the field, and for the first time everyone in the room oriented around her timing. The shift was subtle and total. Mercer still led the table. Holloway still controlled the physiology. Linda still ran the instruments. Yet the map now came from the woman nobody had wanted speaking 10 minutes earlier. Avery watched 3 beats pass. Release suction on the downbeat, she said, not before. The resident nodded without realizing he had done so. Hold through the next contraction. Do not chase the movement. Let it declare itself. Mercer adjusted his grip. Now the next one, Avery said. The suction eased. Blood pooled a fraction. The field changed. Nothing. Another beat. A faint metallic flash, then gone. Mercer's entire body sharpened. I saw something. Holloway called pressure holding. Avery said wait. Mercer held. It took more discipline to wait than to act. In trauma surgery, movement often felt like virtue. But his stillness now had intent inside it, the kind that only appeared when a very skilled person accepted that speed without understanding was just another way to lose. Another beat came. The flash returned. Tiny. Buried near the pericardial edge, shifting just enough with each contraction to scrape trouble into the rhythm. Left and shallow, Avery said. Mercer adjusted. There. The resident inhaled hard. I have it. No, Avery said at once. Do not touch it on the beat. Mercer's voice was low. Count me. Avery listened to the monitor. 1 beat. Another. The room moved with her count without anyone choosing to. Even Linda's hands had gone still over the tray. Not this one, Avery said. Mercer waited. Holloway's eyes flicked from screen to screen again. Come on. The next interval opened. Now, Mercer lifted. It was almost nothing. A tiny metallic splinter, dark with blood drawn free between instrument tips, delicate enough to carry a person's life by less than a fingernail. For 1 second, the room did not understand that it was over. Then the monitor smoothed. Not perfectly, cleanly, The spikes softened into regular peaks. The line that had fought itself for the last several minutes settled into rhythm with the deep, relieved certainty of a heart no longer being jabbed from the inside. Holloway let out a breath that sounded like he had been holding it since the ambulance bay. Rhythm restoring. Pressure climbed. 80, 86. The resident laughed once under his breath from sheer disbelief, then looked ashamed of it and swallowed the sound. Mercer set the fragment into a metal basin. It made the smallest click in the world a sound too thin to carry the weight it deserved. No one spoke for several seconds. Then Linda said quietly, "How did you see that?" Avery did not answer. She was still watching the monitor as if trust had to be earned not by the object in the basin, but by the next 10 beats. 1, 2, 3, all steady. Only then did some small measure of tension leave her shoulders. Mercer looked toward her across the room. He had spent his life measuring competence in gestures. The economy of motion. The right question asked at the exact wrong moment. The absence of panic, the willingness to say "I do not know," and the authority to say stop when everyone else was still moving. Nothing about Avery Cole belonged to a fourth-night nurse. "Where did you learn this?" he asked. Avery did not look away from the monitor. Experience. Mercer gave the answer the silence it deserved. He knew enough people in medicine to hear the difference between practiced modesty and boundary. This was boundary. The repair resumed. This time the room moved with a new kind of concentration. Not frantic, not relieved, simply altered. The old assumptions had burned away. Every hand now recognized that what could not be seen still mattered. Mercer closed with deliberate precision, checking and rechecking the field, letting no hidden edge survive unchallenged. Holloway kept the pressure in a safer range and watched the rhythm with respect bordering on suspicion. Linda's voice lost some of its iron edge and became what it had perhaps always been under pressure, efficient rather than dismissive. Avery remained near the monitor, no longer pretending invisibility, not stepping into authority either. She occupied the narrow ground between them. At some point, one of the scrub techs murmured to the other, "She is not new." The other whispered back, "Then what is she?" Neither of them said it loudly enough to matter. Mason's color improved by degrees. Not much. Enough. The tightness at his neck eased. The chest rise under the drape looked less negotiated, more natural. Holloway called another pressure, and this time there was no strain in it. 91/60. Mercer nodded once and continued suturing. Outside the room, footsteps passed in the corridor, then returned, then multiplied. Security radios crackled faintly beyond the OR doors. Somewhere in that outside world, federal agents were arriving for their wounded Marine, and a story far larger than this room. Inside the OR, no one cared. Not yet. The entire universe remained narrowed to skin-blood thread numbers. Avery glanced once toward the door at the sound of the radio, then back to the monitor. Mercer noticed, not the glance itself, the speed with which she dismissed it. A person with ordinary curiosity would have looked longer. Avery acted like someone who had learned long ago that the room where a body fought to live always outranked whoever was waiting outside it. He reached for sutures. Linda handed them over. Mercer tied cut checked. The resident irrigated. Holloway adjusted ventilatory support and murmured to the unconscious Marine as if the man could hear him and might stay more willingly if someone kept talking. The room had entered that quieter stage of crisis management where sound drops and concentration expands. People often mistook that stage for safety. Mercer knew better. So, apparently, did Avery. The final pericardial repair held. Mason's rhythm stayed clean. The pressure remained usable. No one announced victory. Trauma teams did not believe in victory until the patient survived the next room, too. Mercer placed another stitch and said, still not looking at Avery, "Do you always speak up like that?" A faint shift crossed her face, almost a smile, and not quite. "Only when I am trying to keep someone alive." Linda gave a short sound somewhere between disapproval and reluctant amusement. Holloway said I would appreciate you keeping that habit. No one laughed, but the line loosened the room a fraction. Mercer cut the suture and set the instrument down. He had begun the night with a rookie nurse at the edge of his awareness, another body in new scrubs, another observer rotating through the machine. Now every instinct in him was trying to solve a different problem altogether. Who had put a woman with that kind of eyes into his operating room and called her new? He did not ask again. The answer would come when it came, or not at all. For the moment, the patient mattered more. He closed one layer deeper. The monitor held steady. Avery watched it anyway. The habit was not caution anymore. It was discipline. She kept her eyes on the rhythm while Mercer closed another layer, while Holloway eased the medication support down to a level the heart could carry without being dragged, while Linda cleared used instruments into a metal pan with the clipped efficiency of someone who had long ago trained herself to keep moving no matter what had just happened in front of her. No one in Trauma OR 3 was breathing the same way they had 15 minutes earlier. The air had changed. The first storm in a room was always obvious. Alarms, blood loss, orders fired across the table like rounds in the dark. The second storm was quieter. It came after the save, after hands stopped shaking, after everyone realized how close they had come to following the wrong map. That storm moved through people internally. It changed posture, tone, eye contact. It left behind the kind of silence no one acknowledged because naming it made it too real. Mercer reached for a fresh suture. Linda placed it in his hand before he asked. Their timing had returned, but it was no longer the same timing from earlier in the case. Before, the room had flowed around Mercer as the fixed point, his certainty shaping everyone else's movement. Now, the certainty was distributed. Holloway watched the monitor with almost the same intensity as Avery. The resident no longer treated the screen as background noise. Even Linda, who had spent the first half of the night enforcing boundaries around Avery like they were structural walls, now checked the younger nurse's line of sight before she stepped in front of the bank. Mercer tied cut and irrigated once more. Pressure. 94/62, Holloway answered. Heart rate is settling. Saturation good. Mercer nodded. Keep him there. He worked a moment longer without speaking, then said, Cole. Avery lifted her eyes from the monitor to the field. Sir, come closer. Not into the field. I want your eyes on this angle. Linda looked up so fast the movement made the hanging lamp sway by a fraction. Mercer did not repeat himself. He did not need to. In an operating room, an invitation from the lead surgeon carried the force of a transfer of gravity. The staff felt it at once. Avery stepped forward only as far as he indicated and stopped exactly where the sterile line ended. She folded her hands behind her back so there would be no confusion about where they belonged. Mercer tipped his chin toward the area he had just repaired. If there is anything else in there that I should hate, now is the time to tell me. The words were dry. The room took them as humor because it needed a pressure release somewhere. Holloway let out a short breath through his nose. Even Linda's mouth twitched. Avery leaned just enough to see the line of the repair and the surrounding tissue. Her expression did not change. I do not see another mechanical source. Mercer glanced up at her. You do not know, or you do not see. I do not see. That answer earned the smallest nod from him, the kind men like Mercer gave when accuracy mattered more than reassurance. He returned to the closure. A few feet away, the metal basin holding the extracted fragment sat near the edge of a Mayo stand. Under the operating lights, it looked absurdly small. Not a dramatic shard. Not something cinematic enough to justify the amount of fear it had caused. Just a sliver. Dark, wet, and almost delicate. The sort of thing a person might miss even while staring directly at it. The resident, still pale from the adrenaline dump, looked at the basin twice in under a minute. You ever seen one that small do that much damage? He asked Holloway quietly. Holloway kept his gaze on the monitor. I have seen smaller. The resident looked surprised. Holloway added, The body does not care how fair the fight looks. Mercer heard him and said nothing. The line was true enough to belong to every specialty in the building. Beyond the OR doors, footsteps gathered in the corridor and stopped. A murmur of voices, security radios, the low, controlled tone of men who were trying to ask urgent questions without disrupting a room they did not belong in. Linda glanced toward the door. That will be federal. Mercer did not look up. They can wait. Already are. They can keep improving at it. A scrub tech bit back a smile. Avery turned her head just slightly at the sound of the corridor. Not enough to count as distraction. Enough to register that whoever was waiting outside had finally caught up to the patient on the table. She turned back to the monitor a second later, as if the interruption had been no more meaningful than a passing cart. Mercer noticed again how little curiosity she gave away. That bothered him in a way he could not yet define. Most people, when they heard federal agents outside an operating room, changed shape around the fact. They became more alert, more talkative, more eager to attach the situation to a narrative they could understand. Avery seemed to strip meaning away from it on contact. The priority remained where it had been since the first alarm. Mason Tate, rhythm, perfusion, airway. No broader story, whatever it was, mattered until the body stopped trying to die. Mercer finished another layer and stepped back half a pace. Irrigation. Linda passed the bulb syringe. He flushed the field, watched clear fluid wash through the repaired space, then asked Avery without turning, "Would you have called the second problem if the rhythm had not worsened?" Avery answered immediately, "Yes." That drew Holloway's eyes off the monitor for a second. So did Linda's. Mercer continued when the recovery failed to smooth. He looked up at her now. "That is not a time. It is a pattern." Mercer held her gaze. Avery did not seem to notice the tension in the exchange. Or perhaps she noticed it and simply refused to be moved by it. The pressure came back too fast for a clean recovery. The rhythm stayed irritated. If a decompression works but the heart still sounds defensive, something is still touching it. Holloway gave a quiet hum of agreement before he seemed to realize he had done it. That is exactly what it looked like. Linda set down a used clamp. "You speak like this is routine." Avery returned her attention to the screen. "No, ma'am. Routine gets people careless." The room absorbed that and moved on. Mercer tied off the final visible repair and straightened slowly back, protesting under the hours and the angle. He rolled one shoulder once, then looked at the monitor himself. Mason's blood pressure was still holding. The trace was strong enough now to feel like a promise he did not trust but was willing to entertain. "Ben, I'm here. You comfortable keeping him light for another few minutes?" Holloway checked numbers, yes. Mercer nodded toward the basin. "Bag that fragment. Mark the chart. I want imaging correlation when he is stable enough to move." The resident reached for the basin, but Linda took it first. "I've got it." She glanced once at Avery, then away. It was a tiny thing, that glance, but the room noticed. Linda Graves did not surrender territory often. She had ruled countless overnight cases through competence and sheer force of control. Now she moved around Avery with the care people reserved for a live wire they had not expected to find in the wall. A circulating nurse slipped toward the side computer to begin the chart update. Avery saw the woman hesitate at the terminology field, then start typing the standard language used for post-trauma correction. It was accurate enough, but broad, safe, civilian. Without thinking too hard about the decision, Avery stepped over to the terminal. "May I?" The nurse looked at her, then at Mercer. Mercer was stripping off one outer glove, eyes still on the field. "If you have a cleaner note, write it." Linda's head came up again. Avery took the keyboard. She did not type fast in the frantic sense. She typed like someone entering coordinates. Exact, economical, no wasted movement. The language that appeared on the screen was concise, dense, and sharper than anything usually seen in a civilian surgical note at 2 a.m. Probable acute compressive pericardial event with delayed hemodynamic expression. Mechanical ventricular irritation. secondary to mobile retained fragment near pericardial surface. Controlled decompression with rhythm, timed extraction. The circulating nurse blinked as if reading a dialect of her own language. Holloway read over Avery's shoulder and said, "That is not how anyone in this hospital writes." Avery kept typing. "It says what happened." Mercer looked at the screen from across the room and felt a strange flicker under his ribs. Not recognition exactly, more like proximity to recognition. The note was too compact for residency jargon, too practical for academic style. It carried none of the cushion most physicians used when documentation might be second-guessed later. It was language built to be read under pressure by people who did not have time for decorative uncertainty. Where had he seen that kind of phrasing before? He could not place it. Not yet. At the door window, a dark, suited figure moved into view, then another. The narrow rectangle of glass briefly held the reflection of the OR lights across polished FBI credentials clipped near belt lines. One of the men inside security uniform leaned in, spoke through the crack of the door to a circulating nurse, and was waved away with a gesture that meant not now. Mercer finished removing the second glove and tossed it into the bin. How many of them? 2 agents, the nurse answered. They want confirmation the patient made it through. Then tell them he made it through enough to stay alive while I finish. The nurse nodded. Avery stepped back from the chart once the note was entered and resumed her position near the monitor. She did it so naturally that the movement might have looked like withdrawal, but it was not. It was a return to the center of her attention. Mason's rhythm, Mason's pressure, Mason's body still speaking in details the room could not afford to stop hearing. Mercer went to work on the final closure. His movements had regained their usual confidence, but the confidence no longer came from assumption. It came from verification. Every stitch got a second look. Every change in tissue tone earned a fraction more time than it might have under ordinary circumstances. He no longer wanted speed for its own sake. The night had already taught him what speed without listening nearly cost. Holloway watched him for a moment and said quietly, "You all right over there?" Mercer snorted. "I nearly clamped a heart into arrest because I trusted the wrong story. Ask me later." "Fair enough." The resident kept his eyes down. No one in the room pretended not to hear. Mercer closed one more layer and reached out for the next instrument, before realizing Linda had already placed it into the exact position his hand expected. Their timing had never actually failed. It had simply been interrupted by something larger than any one of them. He accepted the instrument and spoke without looking up. "Cole." "Yes, sir." "When did you first see it?" Avery answered after only a second, which meant she was not inventing the memory now. "In the trauma bay, I thought his breathing looked restricted. In here, when the pulse pressure narrowed without enough visible loss to justify it. And you said nothing." "I did not know enough yet." Mercer paused with the instrument in hand. "Most people say something before they know enough. That is usually why they are wrong." The resident glanced up at her and then away. Holloway's mouth twitched again. Mercer returned to the wound. "You waited until I had a clamp in my hand." "Yes, sir." "Comforting." Avery almost smiled. "You asked me not to hover." A few quiet sounds moved through the room. Not laughter exactly, but the release that comes when fear has exhausted itself, and people are finally able to hear wit hiding inside the edges of a sentence. Linda shook her head once, as if annoyed by the exchange and oddly relieved by it at the same time. Outside the OR, the agents had stopped pretending patience. One of them spoke through the doorway, crack again, low and urgent. The circulating nurse repeated the message for Mercer. "They need the attending's summary for chain of custody and transfer request." Mercer replied without looking up. "They can have my summary when I stop having open layers in front of me." The nurse relayed it. A beat later, a male voice came through the partially open door, controlled but sharper now. "Doctor, this patient is connected to an active federal investigation." Mercer did not even turn. "Tonight, he is connected to my table." The door closed. Holloway muttered, "That should make you popular." "I was never trying for popular." Avery did not react, but Mercer saw the briefest change in her eyes. Not surprise. Approval, maybe. Or simply recognition of a principle she respected. He placed the last of the deeper sutures and signaled for the superficial closure set. Linda handed it over. The room relaxed by another fraction. Not enough to become careless. Enough that the shoulders dropped and breathing stopped, sounding borrowed. At the side computer, the circulating nurse reopened the note to verify one line, then called softly, "Ms. Cole." Avery looked over. "This phrase, rhythm-timed extraction. You want that exactly?" "Yes." The nurse hesitated. "That is going to raise questions." Avery's expression did not change. It should. Mercer heard that and looked up again. The answer was wrong for an ordinary nurse. Not arrogant, not performative, just unconcerned with whether the truth looked unusual on paper. Linda heard it too. She set down a used forceps and said, "Where did you train before this hospital?" Avery turned back to the monitor. "Here and there." "That is not an answer." "It is the one I have." Linda's jaw tightened, but she let it go. Maybe because she sensed the room had changed too much to force the issue. Maybe because some part of her already suspected the answer would not fit into anything as normal as staff orientation paperwork. Mercer finished the superficial layer and stepped back at last. Dressings. The resident moved in. Linda passed material. Holloway adjusted the ventilator again and gave Mason's blood pressure a fresh reading. 98/64. Better than anything the room had a right to expect when the night began. Mercer rolled his neck once and flexed his fingers out of habit, blood returning in a rush to places gloves had cinched too tightly. He walked toward the side table where the basin sat, bagged and marked. Through the clear evidence pouch, the fragment looked even smaller than before. He picked it up between thumb and forefinger, studying the shape through plastic. Not jagged bone, metal. A sliver thin enough to miss, bright enough at the edge to catch light only when it moved. He thought of the timing Avery had called, downbeat, wait, now. He set the bag down. "Ben." Holloway turned. "Yeah. Do you know her file?" Holloway looked from Mercer to Avery, then shook his head. "I know she showed up from the central nurse staffing pool, and half the floor assumed she was green because she did not argue with anyone." Mercer nodded once. "That was my impression too." Holloway let the understatement pass. The OR doors opened before anyone could say more. 2 FBI agents entered with security close behind both men in dark suits with the sleepless, sharpened look of people whose nights rarely ended where they expected. The first was tall and lean, close-cropped hair going silver at the temples. The second was younger, broader, carrying a tablet already lit with some secure case screen. They stopped just inside the room, instinctively lowering their voices in the presence of the patient, even before anyone asked them to. "I'm Special Agent Nolan Pierce," the older one said. "This is Special Agent Eric Shaw. We need status on Staff Sergeant Mason Tate." Mercer peeled off his outer gown. "Alive, repair complete. He is not going anywhere until anesthesia clears him to move." Pierce nodded, absorbing the answer with the visible relief of a man too trained to show much relief. Shaw had already shifted focus to the chart screen, scanning the summary the circulating nurse had left open. He read once, then again. His eyes narrowed. Who wrote this? No one answered immediately. Mercer followed Shaw's line of sight to the note, and then, without fully intending to turn toward Avery. The movement was enough. Pierce looked where Mercer looked. Avery was standing by the monitor with her hands folded behind her back. Face, composed blood pressure trace reflected pale green across one side of her cheek. Shaw stepped closer to the screen. This language. Pierce crossed to his side and read over his shoulder. For the first time since entering, the older agent's controlled expression slipped. He lifted his eyes slowly toward Avery. The room noticed the change before anyone understood it. Shaw said more quietly now, "That phrasing is not civilian." Mercer felt every person in the room become still at once. Linda stopped wrapping an instrument. Holloway turned fully away from the anesthesia tower. Even the resident, who had spent the last several minutes trying to disappear into tasks below his rank, looked up. Avery did not move. Pierce took one step toward her. "Where did you learn combat stabilization shorthand?" Avery met his gaze for a beat, then looked back to the monitor as if the answer mattered less than the patient still under her care. "Medical training," she said. The words satisfied no one. Not the agents. Not the room. Not Mercer, who felt that flicker of near recognition sharpen into something colder. Shaw was already tapping at the tablet in his hand, bringing up a secure search window with the speed of habit. Mercer watched the younger agent enter something, pause, enter more, then stop. Mid-motion, as whatever returned on the screen seemed to catch in his throat. Pierce held out a hand. Shaw turned the tablet so only he could see. The older agent read. His posture changed almost invisibly. He looked from the screen to Avery and back again as if checking whether the person standing by the monitor could possibly be the same person in the file. Mercer took a step in their direction. "What is it?" Pierce did not answer right away. Across the room, Mason's monitor gave a clean, steady cadence into the sudden silence. Avery remained where she was, expression unreadable, as if this moment belonged less to her than to everyone else struggling to catch up to it. Pierce lowered the tablet by an inch. "What is it?" Mercer repeated. Shaw looked at Avery again, then at the file, then back to Avery as though the face in front of him had collided with a piece of paper that should not have existed in the same room. His voice, when it came, had lost some of its official hardness. "She is listed as inactive." The words landed without context, and that made them heavier. Inactive, what Linda said before anyone could stop her. Pierce did not answer Linda. His eyes stayed on Avery. Former classified medical attachment. Joint Special Operations Support. Retired status. 8 years. No one in trauma, OR3, moved. The monitors kept their steady mechanical time. Fluids dripped. The overhead lamps held the field in clean white light. Yet the room itself had become strange, as if every familiar object had shifted half an inch out of place. The resident was the first to break, and even then only with a breath. "That is not possible." Avery did not flinch. Mercer studied her face again now, with the file standing between what he had assumed and what the night had forced him to see. The calm, the timing, the language in the note. The way she watched the room as if danger never arrived from one direction only. It all fit now. What unsettled him was how easily the truth had hidden in plain sight. Pierce stepped closer, careful not to cross into the surgical space. "Avery Cole is not the name on this file." A pause. Then Avery answered in the same tone she had used to stop a surgeon and save a Marine. "It is the name on my badge." "That is not what I asked." "No," she said, "it is not." Shaw looked around the room, as if suddenly aware that every word spoken here might matter in ways none of the staff had expected at the start of shift. He lowered his voice even further. "You were attached overseas to multiple joint operations medical units. Forward trauma stabilization. Extraction support. Field thoracic intervention." Linda stared at Avery with open disbelief. "That is military black site medicine." Avery did not look at her. Mercer folded his arms across his chest. "You put that woman on a probationary nurse rotation." "No," Avery said quietly. "The hospital did." Pierce corrected her without taking his eyes off her. "You applied through a civilian credentialing route after your inactive seal lapsed." "That sounds right." Mercer let the silence stretch a second longer than comfort allowed. "You let this place believe you were new." Avery finally looked at him. "I was new here." That answer struck him harder than any dramatic explanation could have. No apology in it, no excuse, only accuracy. Linda said, "You watched me talk to you like you were still learning how to set a tray." Avery's gaze flicked to her. There was no sharpness in it, no revenge. "You were teaching me how this hospital does it." Linda opened her mouth, closed it, then found nothing useful to say. Holloway leaned against the anesthesia tower, one gloved hand resting on a drawer handle. "You are telling me I have spent the last hour taking cues from someone who has done thoracic saves under fire." Pierce gave a faint, grim smile that did not belong anywhere near an operating room. That would be the short version. Mercer's eyes never left Avery, and the long version. Pierce hesitated. That hesitation said more than a direct refusal could have. There were boundaries even federal agents understood when they touched histories built from sealed orders and dead zones on maps. Avery solved the problem for him. The long version does not help the patient. The room went still again. There it was, Mercer thought. Not arrogance, not avoidance for the sake of mystique. A hierarchy of value so deeply set that every other conversation had to justify its own interruption. Pierce exhaled slowly. No, it does not. Shaw turned the tablet face down in one hand. Your status says retired following overseas operations and support capacity. Avery said nothing. Pierce added, it also says medical commendations withheld from public release. Still nothing. Holloway looked from the agents to Avery and gave a short disbelieving shake of his head. How many people in this hospital know? Avery returned her attention to Mason's monitor. Enough to process payroll. The line was so dry that under any other circumstances it might have earned a laugh. In the room, it landed as a reminder of how completely she had stepped around curiosity her entire life. Mercer moved toward the sink, stripped off his remaining gloves, and washed his hands in silence. He needed the motion. Needed the familiar friction of water and soap, while the rest of the room rearranged itself around a truth too large to absorb all at once. The sink ran. No one else spoke. When he shut off the water, he turned back to the room and found Avery in the same place, eyes still on the patient. He had known surgeons who demanded worship, and nurses who demanded acknowledgement, and physicians who could not function unless every room recognized the full shape of their experience. Avery had just been identified as something far beyond the small role everyone assigned her, and her first instinct had not been correction or revelation. It had been to keep watching a recovering man's blood pressure. That, more than the file convinced him. Mason's rhythm dipped. Not violently. Not the hard, ugly collapse from earlier. Just enough to shift the room's focus away from Avery and back to the table in one clean motion. Holloway leaned toward the monitor, pressure softening. The agents stepped back immediately, their investigative urgency giving way to the instinctive respect all outsiders developed in a real medical room. Mercer crossed back to the bedside. Avery had already moved closer to the monitor bank. Numbers, Mercer said. 91/58, Holloway answered. Heart rate rising a little. The resident looked toward the field, eyes widening. Did we miss a bleed? No. Avery's response came before anyone else could speak. Her gaze stayed fixed on the rhythm, residual irritation. Mercer looked at her. Dangerous. Only if we overcorrect. Linda glanced at the agents, then back at Avery, as though still having trouble reconciling the woman who had quietly accepted instruction at the start of shift with the one now answering the surgeon in front of federal witnesses. Holloway asked, You think this is post-decompression adjustment? Avery nodded once. His heart is relearning the space around it. Slow support. Do not chase every dip. Mercer studied the screen, then the chest, then Mason's color. He made the call without hesitation. Fine. We do not flood him. Small correction only. Holloway adjusted the medication, then ventilation in measured increments. The pressure wavered, dipped once more, then steadied on its own, exactly as Avery had predicted. Pierce watched the exchange with a look Mercer recognized from high-stakes rooms and other forms. It was the expression of a man realizing that the person he had come to question had already become indispensable before he even arrived. The rhythm cleaned up. Mercer took one more look at the field and satisfied himself there was no fresh source of trouble, then finally let the closure stand. All right, he said, we are done here. The words did not feel like triumph. They felt like permission to exhale. Linda signaled the transition to post-operative prep. Dressings were secured. The resident began cleanup of the field with the relieved focus of someone whose body was only now discovering how much fear it had stored. Holloway started walking Mason through the first controlled steps toward transfer. At the edge of the room, Pierce spoke again quietly this time. I need to ask you some questions. Avery did not look at him. Then you need to wait. Shaw glanced at the recovering Marine. Can he hear us? Not clearly, Holloway said. And if he can, he does not need federal conversation as his welcome back. Pierce inclined his head a concession. Understood. Mercer stepped away from the table and removed his gown. You can do your questions in recovery after I know he is stable enough to survive your curiosity. Pierce almost objected. Then he looked at Mason and decided against it. The transfer to recovery took 10 more minutes, though it felt longer because the room had too many unsaid things in it now. Avery helped prepare the lines without stepping into the center. Linda let her do it without comment. Holloway gave her the kind of sideways glance men reserved for facts they were still reclassifying in their heads. The resident avoided staring only by focusing so intensely on tape and tubing that he nearly missed a clamp. No one treated her like a rookie anymore. The strange thing was that Avery herself treated the change as if it did not exist. When the transport bed rolled in, she checked line Slack-verified chest dressing security confirmed the monitor connection and stepped aside exactly when the room needed her to. Not too soon. Not too late. Mercer noticed that every movement she made conserved energy. Nothing decorative, nothing rushed. The economy of a person trained for long nights where waste became danger. The doors opened, the bed rolled. As Mason was moved out of trauma OR 3, Pearson Shaw fell in behind at a respectful distance, no longer trying to lead the situation. The shift had already occurred, and all of them knew it. The recovery wing felt almost unreal after the intensity of surgery. The lights were dimmer there, the sound softer, the machinery less aggressive in its announcements. Hallway voices dropped automatically. Shoes squeaked less. Even grief and fear seemed to speak in lower tones once patients crossed that threshold. Mason was settled into a monitored room near the nurse's station. Holloway stayed through handoff, giving the PACU nurse a concise summary. Mercer remained nearby, arms folded, watching the first few minutes with the suspicion of a man who trusted recovery only after it had insulted him enough times. Avery moved to the IV side and checked the line with light, efficient fingers. Pierce waited by the doorway until the immediate work was done. Shaw stood a few feet behind him, tablet tucked under one arm. Only when the room settled into the temporary rhythm of post-operative vigilance did Pierce speak. You left service 8 years ago. Avery adjusted the flow rate by a fraction. That sounds familiar too. Pierce was not smiling now. You were attached to casualty support and joint operations theaters under a compartmented designation. Avery kept her eyes on the line. I worked where they sent me. Mercer leaned against the counter near the foot of the bed and watched her. And now you work here? Yes. Why? The question was so direct that even Pierce looked at Mercer. Avery straightened and checked Mason's pupils with a penlight. Her voice, when it came, was softer than it had been in the OR, but no less controlled. Because here, when the shift ends, the walls stay where they are. No one answered that. Holloway looked away first. Pierce tried a different angle. You treated operators in theaters where evacuation times were measured in blood loss. Avery capped the penlight and slipped it into her pocket. A lot of medics did. Not many with your file. Avery turned her head just enough to meet his eyes. Then maybe the file is flattering. Shaw made a sound that might have been disbelief if he had allowed it to finish. Mercer watched the exchange and felt the last pieces align. This was not modesty in the ordinary sense. It was something harder, a deliberate refusal to let identity inflate around old work. The past existed. It had clearly shaped every instinct she brought into the room. But she would not let it become a performance for anyone, not even for men who had clearance to read it. Mason stirred. The change was small at first, a shift beneath blankets, a tightening around the mouth. Then his eyelids moved. Holloway straightened. The PACU nurse stepped closer. Mercer pushed off the counter. Avery stayed where she was. Mason opened his eyes, halfway unfocused, dragged upward from anesthesia and fragments. The room around him was probably light and blur and pain. He breathed against it. His gaze drifted to the ceiling, then sideways, and settled on Avery standing near the IV pole. For a moment, there was only confusion. Then something deeper moved behind his eyes. His brow tightened, not with fear, with effort. Recognition trying to push through morphine fog and injury. He swallowed. His voice came out rough and low. "You." No one moved. Avery's face remained still. "Easy. Surgery is over." Mason kept looking at her. "No." Another swallow. "You stayed." The words meant nothing to Mercer and everything to Mason. Avery's hand rested lightly on the bed rail. "You are safe." His breathing steadied at once in a way medication could not have accomplished. Pierce looked sharply between them. "You know her." Mason's eyes never left Avery. "Desert evac." His voice cracked. "Dust storm. Bird late. She would not let me close my eyes." The room changed again. Shaw lowered the tablet without seeming to notice he had done it. Holloway glanced at Mercer. Linda, who had come into recovery under the pretense of finishing paperwork, went completely still in the doorway. Mercer looked at Avery. This time she did not deny it. She did not confirm it either. She simply drew the blanket a little higher over Mason's chest and said, "You made it then, too." Mason's eyes closed for a second, not in sleep, but in surrender to the relief of being understood. When he opened them again, some of the fear was gone. Pierce took one careful step forward. "Staff Sergeant Tate, can you tell me where you know her from?" Mason's head moved weakly against the pillow. Whether it was refusal or exhaustion, no one could tell. Avery answered for him, but not in the way Pierce wanted. "He needs rest." Pierce looked frustrated for the first time that night. "He is a protected witness in a federal case." Mercer's reply came hard enough to stop further movement, then protect him by letting him recover. Shaw touched Pierce's sleeve, a small gesture. Enough. Pierce nodded once and stepped back. The room settled again. For several minutes, no one asked anything. The monitors hummed. The IV pump clicked in soft intervals. Footsteps passed the doorway and faded. Somewhere down the hall, another patient began asking for ice chips with stubborn repetition. Mason drifted in and out, but each time his eyes opened, they found Avery first. Not with panic. With trust. The kind formed in circumstances most rooms never had to imagine. Mercer watched that too. He thought about the instant in the OR when Avery had said not yet, and he had waited. Thought about how naturally she had read a body under pressure, how precisely she had moved around a room not built for her authority. He had assumed talent then, training, then hidden experience. What sat in front of him now was more than that. It was history. Shared survival. Lives crossing in places far outside the clean laws of civilian medicine. Linda broke the silence at last, speaking from the doorway as if unsure whether she had earned the right to step farther in. "You could have told someone." Avery did not turn around. "About what?" Linda gave a short breath. "About who you are." Avery checked the monitor leads one more time. That would not have changed his rhythm. Linda looked down. Mercer almost smiled despite himself. Holloway said softly, "No," but it would have changed ours. That made Avery pause. For the first time since the reveal, a shadow of something like weariness touched her face. Not defeat, not regret, just the fatigue of a person who understood that every room wanted biography the moment competence became impossible to ignore. She turned then, looking not at Holloway alone, but at all of them. Mercer, Linda, the agents. The resident lingering outside with a chart he had no real reason to still be carrying. "I came here to work," she said, "not to arrive." No one had an answer ready for that. Pierce cleared his throat after a moment. "Your record indicates several unofficial commendations under seal." Avery's expression flattened again. "Records indicate many things. It also says you left after a casualty event in Kandahar." The room went even quieter than before. Mercer saw the shift in her posture before he saw it in her eyes. A tightening through the shoulders so slight another person might have missed it. Holloway saw it too and looked away at once, recognizing the shape of a door that should not be pushed. Avery's voice cooled by a degree. "Agent Pierce." That was all. No anger, no volume. Yet Pierce heard the boundary in it and stopped. Shaw spoke instead gentler than before. "We are not trying to make this harder." Avery nodded once. "Then do not." Mason stirred again, drawn back by the change in voices. His eyes opened only a little this time. He looked toward Pierce, then Shaw, then back to Avery, as though measuring whether the room was safe by whether she remained in it. Pierce noticed. Whatever else federal work had trained into him, it had taught him to recognize authority of another kind when he saw it. He stepped back from the bedside. "We can do this later." Mercer answered before Avery had to. "You can do it after morning rounds." Pierce gave him a look. "Doctor, take the win." He lived. A beat passed. Then Pierce nodded. He and Shaw withdrew to the hallway, though neither went far. Mercer could see their silhouettes through the partial glass, standing side by side under the low hall lights, speaking in quiet, rapid phrases while Shaw worked his tablet again. Inside the recovery room, the atmosphere loosened by increments. Linda came farther in and busied herself with a chart she did not truly need to adjust. After a moment, she said, still looking at the paper, "I rearranged your tray because I thought you were organizing it like a student." Avery checked Mason's pulse at the wrist. "You were not wrong about the tray." Linda gave a short, humorless laugh. "That is very generous." "I meant it." Linda finally looked at her. "You are not angry." Avery let Mason's wrist settle back onto the sheet. "No." Linda absorbed that and seemed almost more unsettled by it than she would have been by resentment. "You should be." "Number." Mercer spoke from the foot of the bed. "She has had rougher nights than this." The statement was not flippant. It landed with its full weight. Avery looked at him. Neither thanked the other for understanding. They simply let the truth stand where it was. The resident, still at the threshold, said awkwardly, "I am sorry I did not see what you saw." Avery turned toward him with a look that softened by a fraction. "You were where you needed to be." He was on the table. "I was at the monitor." The resident nodded, chastened and relieved at once. Holloway checked the sedation level and said, "That is exactly the part none of us like admitting." Mercer leaned back against the counter again. "Speak for yourself." "I am getting better at it by the hour." That earned him the smallest real smile Avery had shown all night. It changed her face more than anyone expected. Not because it made her look younger, because it made visible the version of her that could have belonged in any ordinary hospital, any ordinary shift if life had offered her ordinary rooms to learn in. Mason slept more deeply after that. His vitals held. The dangerous edge left his color. The PACU nurse completed the final notation and stepped out to update bed management. Around 3 in the morning, when the unit had settled into the softer exhaustion that follows controlled crisis, Mercer found Avery alone for a minute by the medication counter just outside Mason's room. She was washing dried adhesive from her fingers with an alcohol pad, working methodically at the stubborn residue, as if the task deserved the same attention as everything else. He stopped beside her. "Why nursing?" Avery kept rubbing at the adhesive. "Because it is work." "That is not enough of an answer for me." It was enough for HR. Mercer watched the alcohol pad turn dull against her skin. You could have walked into any emergency command team in the country with what those agents just read off a screen. Avery dropped the used pad into the bin. "And here I can help the patient who needs a blanket. The man who cannot reach his water. The woman who is afraid to sleep because no one explained the machine beside her. Those things matter too." Mercer looked at her for a long moment. "Yes," he said at last, "they do." He had no argument for that, only respect. At the nurse's station, dawn paperwork was beginning to creep into stacks. A clerk yawned over a printer. Somewhere downstairs, a delivery truck backed into a loading bay with a long mechanical beep. The hospital was turning toward morning without yet admitting it. Pierce reappeared at the end of the hall but did not approach. He waited until Avery noticed him, then touched 2 fingers briefly to his temple in a gesture that was not quite official and not quite personal. Avery inclined her head once. That was all. The agents left a few minutes later without further ceremony. Mercer watched them go, then looked back through the glass at Mason, sleeping in recovery. and Avery checking the drip chamber one more time, though it did not need checking. He realized then that the mystery had shifted. It was no longer about whether she had been something extraordinary before walking into Mercy Harbor. It was why someone who had survived that kind of work would choose after all of it to return to the smallest forms of care without needing anyone to know what she had once been. He never asked the question aloud, not because he was no longer curious, because some answers became clearer when left in the quiet where they belonged. The rest of the night moved forward the way hospitals always did after something extraordinary by pretending it had only been another shift. At 4:10 in the morning, the recovery unit smelled faintly of warmed saline coffee gone stale on a counter. No one had wiped yet, and that thin, medicinal chill that seemed to live inside every hospital vent. The overhead lights were dimmed enough to spare sleeping patients without ever letting the place feel fully dark. Monitors murmured from half-open rooms. A supply cart rolled somewhere far down the hall. Someone laughed softly at the nurse's station and then remembered where they were and stopped. Avery stood beside Mason Tate's bed, checking the dressing at his chest with the same calm she had used in the operating room. The incision site looked clean. The rhythm on the monitor stayed regular. The blood pressure was not strong enough to impress anyone who did not understand what it had survived, but it was holding on its own. She looked at the clock. 4:11. The overnight shift had not ended, but it had changed shape. The frantic center had burned off. What remained was the long tail of the night, the part that demanded steadiness instead of speed. Medication checks, pain control, updating charts, quiet conversations with patients waking into confusion, reassurance repeated in different words to families too tired to process information the first time. This was the part of the job Avery seemed to understand with the same depth she brought to crisis. She adjusted the blanket over Mason's shoulder. His face, scrubbed of blood and partially lit by the monitor glow, looked younger now. Not young in the careless sense, young in the way combat always made visible once a person was finally still enough to be seen as more than a body under pressure. The corners of his eyes held strain. A faint line near the mouth hinted at years spent tightening against orders and danger and whatever came after both. His eyelids fluttered. Avery leaned closer. "Take it slow." Mason drew a shallow breath and opened his eyes. This time, the fog of anesthesia had thinned. He blinked up at the ceiling, then toward the sound of her voice. Recognition came more quickly now. "You were there," he said, voice scraped rough. Avery nodded once. "I was here." He looked at her for another second, reading the careful answer for what it was and letting it pass. Pain touched his face, and Holloway, who had returned to the room to review the latest numbers before handing him fully off, reached for the IV pump. "Easy," Holloway said. "You took the scenic route back." Mason tried to form a smile and failed by half. "You a comedian, Doc? Only when my patient is rude enough to survive." That got the slightest breath of a laugh out of him, which turned into a wince. Holloway adjusted the analgesic dose and watched the line settle. Mercer stood near the foot of the bed, jacket on now over fresh scrubs, arms folded loosely. He had changed clothes, but not expressions. Something in his face remained turned inward, as if part of him was still in trauma or 3, replaying the exact angle of a clamp he had not placed. He waited until Mason's breathing eased before stepping closer. "I am Dr. Mercer," he said. "You came in with 3 gunshot wounds, one close enough to your heart to make the night difficult." Mason's eyes shifted toward him. Did I make it annoying? Mercer almost smiled, profoundly. Mason's gaze moved again back to Avery. "She saved me." The room did not answer at once. Avery checked the monitor leads and said, "The team saved you." Mason's expression changed just enough to suggest he knew the difference between politeness and truth. But he let her have the answer. Mercer looked at Avery across the bed and said nothing. Holloway busied himself with the chart. The PACU nurse wrote down the updated pain score. No one argued with Mason's statement. No one confirmed it either. The room had become too familiar with Avery's refusal of spotlight to challenge it head-on. A few minutes later, Mason drifted back toward sleep. his body finally choosing rest over vigilance. Avery remained beside him until the lines and numbers convinced her the rhythm of recovery had settled again. Then she stepped into the hallway. The first person she saw was Linda Graves. Linda had been waiting near the nurse's station with a clipboard in hand, though from the untouched page and the way her fingers rested on the edge, it was clear she had not actually been reading. She looked up as Avery approached. For 1 second, neither woman spoke. Then Linda held out the clipboard. "I need your signature on the transfer confirmation." Avery took the pen. Linda watched her sign, then said, "You write like someone who learned on moving ground." Avery handed the clipboard back. Sometimes the paper moved. Linda accepted that answer the way she seemed to accept most things about Avery now, not by fully understanding it, but by refusing to insult it with shallow curiosity. "I owe you an apology," Linda said. Avery looked at her. "I decided who you were before the shift even started," Linda continued. "That was my mistake." Avery's expression softened by a fraction. "You had a new nurse on your floor. It made sense." "No," Linda said. It made habit. The word hung there between them. Avery could have dismissed it. Could have made things easier for both of them by saying none of it mattered. Instead, she gave Linda the respect of honesty. "You were trying to protect the room?" Linda gave a short breath that might have been a laugh if the night had held less weight. "And you were protecting the patient. Those are not opposing jobs." Linda looked at her for a long moment, then nodded once. "No, they are not." At the station, the resident from the OR hovered over a chart clearly pretending to be occupied. When Avery turned in that direction, he straightened too quickly and nearly dropped his pen. "Ms. Cole." "Avery is fine." He swallowed. "Avery, I wanted to say thank you." She glanced at the chart in his hand. "For what?" "For speaking." Avery leaned one shoulder lightly against the counter. The corridor light caught the fatigue under her eyes now. Not dramatic, simply human. You would have spoken if you had seen it. He looked down. "Maybe not fast enough." She considered that. "Then next time you will." The resident nodded. He looked like he wanted to ask 10 more questions and understood he had earned none of them yet. At the far end of the hall, a patient call light blinked over room 12. An elderly woman recovering from a bowel obstruction had been pressing it every 15 minutes because she hated the sound of the sequential compression sleeves on her calves and believed turning them off would improve her sleep. Avery noticed the light pushed away from the counter and started walking before anyone else moved. The resident watched her go, momentarily forgotten chart still in hand. Holloway came up beside him with a paper cup of fresh coffee and followed the same line of sight. "There," he said quietly, "that is the part most people do not understand." The resident looked at him. "What part?" "She can stop a surgeon in the middle of a trauma and then go adjust compression sleeves for a woman who thinks the machine is haunted. Same level of attention. Same seriousness." The resident said nothing. Holloway took a sip, winced at the temperature, and added, "That is not common." Inside room 12, the elderly patient was awake and annoyed. "These things are ridiculous," she told Avery the moment she entered. "They keep squeezing my legs like they want information out of me." Avery moved to the bedside and checked the fit of the sleeves. "They are trying to keep your blood moving." "My blood was moving fine in 1978 without machine boots." Avery adjusted the tubing and smoothed the blanket over the woman's knees. "I believe you." The woman narrowed her eyes. "You are humoring me." "No, ma'am. I'm just not arguing before sunrise." That won a reluctant smile. Avery lowered the pressure setting slightly and explained what the machine was doing in simple terms. She listened while the woman complained about the food, the pillows, the hospital television, and her son, who still had not called back. None of it seemed beneath Avery's patience. She answered each complaint with the same concentration she had given a failing monitor. By the time she stepped out again, the call light was off, and the woman had settled. Mercer had been watching from the opposite side of the station. He pushed away from the counter when she returned. "You really mean it?" Avery glanced at him. "About what?" "Work." She looked toward Mason's room, then toward room 12, then down the corridor where another nurse was helping a man with a walker shuffle toward the bathroom. "Yes," Mercer let that sit. "You are off service in an hour," he said. "I know. I am putting in a commendation." Avery's eyes moved back to him. "For whom?" "For you. Number." The answer came without heat, but it was immediate enough to make him pause. "You do not even need to hear what it says," he said. "I know what it will say, and it will not help the next patient." Mercer studied her face. "That is not the only standard we use. It is mine." He almost argued. Not because he thought she was wrong, because he had spent a career watching talent go unnoticed when institutions failed to write it down. Recognition mattered in practical ways. It shaped assignment's authority who got listened to the next time a room started moving too fast toward the wrong answer. He chose his next words carefully. "What happens when the next surgeon you challenge is less willing to stop than I was?" Avery held his gaze. "Then the patient will decide how loud I need to be." Mercer gave a short breath of surrender. Not agreement exactly. More like respect meeting a wall it understood would not move. "I am writing it anyway," he said. Avery did not argue further. Whether because she knew he would, or because she had spent enough of her life choosing which battles deserved energy, he could not tell. Pierce returned just after 5. He came alone, this time suit jacket folded over one arm, shirt collar slightly loosened, looking more like a tired man at the end of an impossible night than a federal agent. He stopped at the station and waited until Avery noticed him. She walked over. Mercer remained where he was, but did not pretend not to listen. Pierce kept his voice low. "He is expected to make it. That is the goal." Pierce nodded. "There will be interviews later. Statements, security questions, administrative noise." Avery said nothing. He looked down the hall toward Mason's room. "He asked for you when he woke again." A pause. "That is not unusual after trauma," Avery said. "No," Pierce replied, "it is not." But the look he gave her suggested they both knew this was not only that. He slid a small folded card across the station counter. No visible title on the outside. Just a number written in dark ink. "In case anyone makes your life difficult over tonight," he said. Avery did not touch the card right away. Federal backup for hospital politics seems excessive. Tonight has already been excessive. Something almost like amusement moved at the edge of her expression. Almost. She took the card and tucked it into a pocket without looking at it. Pierce hesitated, then added, "For what it is worth, some of us remember what you did before you disappeared." Avery's face went still in a different way then. Not cold, not welcoming. A kind of inward quiet. "I did not disappear," she said. "I left." Pierce accepted the correction with a nod. "Right." Neither of them said more. He turned and walked out of the unit footsteps, fading toward the elevators. Mercer watched him go. When he looked back, Avery had already moved on to the medication cart, checking another patient's morning antibiotic against the chart. Day shift began arriving a little after 6, bringing with it the smell of outside air on jackets, fresh coffee, and the tiny burst of louder conversation that belonged only to people who had not yet inherited the night's fatigue. News of what had happened moved ahead of details. That was always the way. By the time the first-day charge nurse reached the station, she already knew there had been a Marine and FBI presence, a chest case that almost went sideways, and something about a new nurse no one could explain cleanly. People looked at Avery differently now. Some with curiosity. Some with caution. Some with the embarrassed politeness of those who realized they had overlooked her earlier in the week and were mentally replaying every interaction for hidden signs they should have noticed. Avery responded to none of it. She gave handoff reports in clear, concise language. She answered questions. She corrected a dosage timing error in one chart before it could travel any farther. She helped transfer a post-op patient who became dizzy standing too quickly. When a family member near the elevators started crying after hearing an oncologist's morning update, Avery was the one who quietly found tissues and water without turning the moment into performance. Mercer finished his operative note in the attending office, signed the commendation form anyway, and carried it himself to the nursing station. He found Avery there, clipping a fresh pen into her pocket and gathering her things with the compact efficiency of someone who never carried more than was necessary. He placed the folded form on the counter between them. She glanced at it once. "You really did it?" "Yes." Avery looked at the signature line, then back at him. "You were under no obligation." Mercer rested one hand on the counter. "No, I was under instruction." "From whom?" "From the part of me that dislikes nearly making avoidable mistakes." Avery said nothing. He went on more quietly. "You changed the course of that surgery. Twice. I would prefer the official record not pretend otherwise." She touched the edge of the form with one fingertip, but did not pick it up. "Records are never the whole story." "No," Mercer said. "But they should at least stop lying." That earned him the faintest smile. She folded the paper once and set it beside her bag. Not acceptance exactly. Not refusal either. Just temporary surrender. Holloway appeared at the station with another coffee and a face that suggested he had considered going home twice and had not yet trusted himself to leave. He looked from Mercer to Avery to the folded commendation and lifted a brow. "Should I be offended, nobody is giving me awards for not fainting when the new nurse overruled thoracic surgery." Mercer replied, "You may draft your own if you like." Holloway sipped the coffee and winced. That was a joke, and yet somehow insulting. Avery picked up her bag. "You did well." Holloway looked at her. "That means more than I want to admit." Linda came up behind them, carrying the last of the overnight paperwork. She set a discharge summary into the outgoing tray, then reached into her pocket and pulled out a small silver trauma shears charm attached to a plain ring. "It was on a retired keychain in my locker," she said, holding it out to Avery. "An old shift marker from years ago. I do not really carry keys anymore." "You should." Avery looked at the ring, then at Linda. "This is unnecessary." "Probably," Linda said. "Take it anyway." Avery accepted it after a brief pause. She turned the small shears charm once between her fingers, then slipped it into her bag. "Thank you." Linda nodded, satisfied with that, and nothing more. By 6:30, the first light of morning had begun to spread across the hospital windows. The city outside was waking in layers. Traffic thickened on the roads beyond the parking structure. The hard black of night softened to blue, then to gray, touched with gold. In room 12, the elderly woman with the compression sleeves was finally asleep. In recovery, Mason's vitals remained steady enough for step down once a bed opened. Avery stood one last time outside Mason's room before clocking out. She did not go in at first. She simply watched through the glass. He was sleeping, chest rising, evenly monitor tracing a rhythm that now seemed almost ordinary. The kind of ordinary people overlooked every day because they had not spent the night fighting for it. After a moment, she opened the door and stepped inside. Mason's eyes opened before she reached the bedside. This time, he looked more like himself, whatever self might mean for a man who had crossed such a night. "You leaving?" "Yes." He studied her face with the quiet intensity of someone assembling memory from fragments. "They told me. I got lucky." Avery adjusted the blanket near his shoulder. "You got surgery." "That, not what I meant." She met his gaze. Mason swallowed. "Back then, too, I mean. They said dust killed men slower than bullets. Hard to breathe, hard to see, hard to tell if the bird was coming. I remember your voice." Avery's hand rested on the rail. "You remember enough." He breathed out carefully. "I thought I dreamed that part." "Number." A faint smile touched one corner of his mouth. "You still talk like there is no point wasting words. Some nights prove it." He looked at her for a long second. "Thank you." The room held still around the words. Avery gave a small nod. "Get stronger." Mason's eyes drifted briefly toward the hallway where the day shift noise had begun to rise. "You going to tell them who you are?" Avery's expression changed by almost nothing. "I am a nurse." He let out the softest laugh, then winced and stopped. "That is meaner than lying. It is more useful." Mason closed his eyes for a second, smiling despite the pain. When he opened them again, the smile had faded into something steadier. "Then be that." Avery straightened the edge of the sheet and stepped back. At the door, Mercer was waiting. He had not interrupted, though she suspected he had heard enough. They walked together into the corridor. For a while, neither of them spoke. The station behind them hummed with fresh shift energy. Phones ringing, computer keys clicking, new faces taking over old burdens. Near the elevators, Mercer stopped. "I have one more question," he said. Avery adjusted the strap of her bag on her shoulder. "You have had several. This one matters less to the hospital than to me." She waited. "When you spoke in the OR, he said you sounded like you had been ignored before." Morning light touched the glass behind him, outlining one side of his face. Avery looked past him toward the windows. "Most people who stand near walls have." Mercer took that in. "I am not asking for a history." "I know." A pause. Then she said, "In some rooms being heard is a luxury. In others, it is a countdown. You learn the difference." Mercer exhaled slowly. There was no answer that matched the truth of that without trying to claim pieces of a life he had not lived. "I'm glad you spoke," he said. Avery looked at him. This time her smile was visible. Small, tired, real. "So am I." The elevator arrived with a soft chime. Mercer stepped back to let her enter, but before the doors closed, he said, "Cole." She looked up. "Tonight changed how this floor will listen." Avery held his gaze for a beat. Then the patient got more than surgery. The doors slid shut. She rode down alone, descending through the layers of the hospital as morning brightened above ground. In the mirrored metal of the elevator wall, she looked exactly as she had looked when she arrived. Blue scrubs, hair, pulled back badge, clipped in place, face marked only by fatigue. No trace of the night visible to anyone who had not stood in the room with her. On the ground floor, the lobby had begun filling with ordinary morning lives. A man carrying flowers too early for visiting hours. A woman in business clothes arguing softly into a phone. A teenage volunteer arranging newspapers by the coffee stand. Security guards trading greetings with staff coming off shift. Avery crossed through them unnoticed. Near the front doors, an elderly patient in a wheelchair was trying to reposition a slipping blanket, while his daughter dug through her purse for parking validation. Avery stepped over, tucked the blanket around his knees, and checked that the footrests were locked. The daughter looked up, startled by the help. "Thank you," she said. Avery nodded once. "You are welcome." Then she kept walking. Outside, San Diego was washed in early sun. The parking lot still held the coolness of night, but the day was already beginning to press through it. Gull calls drifted faintly from somewhere west of the hospital. The sky over the city had gone pale blue, and the glass front of Mercy Harbor reflected back a building that looked calm, almost harmless from the outside. Avery paused on the steps and slipped her badge off for a moment, rubbing the faint indentation it had left against her skin. Then she clipped it back on. Nurse Avery Cole. The title sat where it belonged. Behind her, several floors up, a Marine slept with a steady rhythm in his chest. A surgeon was writing notes with more honesty than he had intended when the shift began. A senior OR nurse was starting a day by rethinking what competence looked like when it entered a room quietly. A resident would spend a long time remembering that monitors told stories too. And somewhere in the hospital room, 12 would probably ring again, because compression sleeves remained intolerable before breakfast. Avery started toward the parking structure. Her pace was unhurried. Not the walk of someone leaving a battlefield, though perhaps it had once been. Not the walk of someone expecting applause either. Just a woman ending a shift. As she reached the crosswalk, her phone buzzed once in her bag. She checked it at the curb. A number she did not have saved. One message. "Glad he made it. Stay ordinary if you can." No signature. Avery read it once, deleted it, and put the phone away. The light changed. She crossed the street. By the time the sun cleared the upper edge of the parking deck, she had disappeared into the morning traffic with everyone else heading home from work, carrying nothing visible except a bag, a badge, and the silence of someone who knew exactly how much of herself the world needed to see.